Elbow posterolateral approach is called Cocker approach. Access to the radial head, lateral collateral ligament, and access to coronide. It is 5 cm longitudinal incision, curved incision of the lateral condyle and extending distally to the radial head. No internal nervous plane, but dissection is between unconeus and ECU. Structures at risk are posterior trochleus nerve and radial nerve. Pin is at risk if dissection is beyond annular ligament. Always pronate the forearm to avoid pin injury. This approach it should not be utilized in exam purposes because there is increased risk of abutting and compromising the blood supply to the posterior aspect of humerus.